You've come out in the morning to bring everyone in to eat, and you have found this wound right here on a hind leg. This is a bit of a real life scenario because many, many years ago I went out to feed Gigi and found this exact wound on her hind leg. What should you do? Step one, take a picture. You've probably got this handy dandy device in your pocket to do that with, so take a picture. All the guts, all the gore, I want to see it all. I know that the wound might be dirty. That's okay, I'm not judging you. I want to see how dirty your horse got it because that's what they do. And I'd like a picture relatively far away. So kind of this range here where I can see where it is on the leg. I'm not looking for big details in this image. Next thing I'm going to have you do is bring them up to the barn. I don't necessarily need you to send me that picture yet or even call me yet. We're getting there shortly. But the next thing I would do is come up to some place flat and clean, preferably concrete. It just makes this next part easier. And hose the leg really, really well. We're going for a couple things here. We want to make sure that bleeding has stopped, and we want to make it easier to see what the edges of the wound actually are. So for example, on this wound, the edge is right here, and then we have simulated bleeding down below it. But this wound stops right at her tendon sheath. Now, I didn't know that at the time, but that's a really big deal. The end of it is here, her tendon sheath is right here. So luckily it wasn't affected, but I can't tell where that end is with the blood going on here. So like I said, what I have you do is using just water, nothing else, no peroxide, no alcohol, no betadine, no Chlorhex, no nothing, just water. You're gonna hose this until we make sure the bleeding has stopped and we have it clean so that we can see the edges. The next thing I'm gonna have you do is once again, use that handy dandy device in your pocket to get me some different pictures of it. So I want a picture up close, and I want it from, you know, if it's a wound like this on a leg, I want a couple different angles. So I want a side, a back, a front side. As your veterinarian, I'm gonna use those pictures to try to assess where this wound is. Is it near synovial structures? For example, this one was kissing the tendon sheath. So the first thing I had to do as a veterinarian was assess, is this actually in the tendon sheath, and then move on from there. So now that you have those pictures and you have the wound hosed down, you can give me a call and send me those images, and now we can talk about the wound and we can move forward with a plan. Let's talk a little bit about what you should have on hand to put on this wound after your veterinarian comes out and takes care of it, or that you should have on hand for them to instruct you how to properly use. One of the biggest things that I use is silver sulfadiazine ointment. This is a prescription item, so again, that veterinarian you've got a great relationship with, might be worth talking to them about having this on hand. You can also use Neosporin or triple antibiotic ointment as well, but making sure you have it on hand ahead of time is key. Silver sulfadiazine is good for lots of different things. You can put it in nearly every wound. You can also use it for eyes under the direction of a veterinarian only, but again, lots and lots of uses for this. It is an antibacterial, antifungal, antiviral, all the things. Great, great, great choice to have on hand. Also works well on burns when you make poor choices, like don't let go of the rope when they pull it out of your hands. The other thing that I like to have on hand is something that has a little bit of steroid in it. This is our preferred. It's called Wound Wonder RX. RX because this one is by prescription. He also makes a product called HC. But this is, again, it's got a little bit of an antibacterial. It's got a tiny amount of chlorhexidine in it. It's got a lot of fat-soluble vitamins, and then it has a steroid in it. And the key to granulation tissue, or what we like to term proud flesh, is having some steroid on hand to keep those cells in check. Let's talk about some bandaging material. We have a whole video on this, so I'm not gonna go in depth on the hows, but I'm just gonna go over real quick some bandaging material you should have on hand. This is Elasticon, often imitated, never duplicated. You want name brand Elasticon. It is relatively easy to find, often though cheaper through your veterinarian than many of those other sources you're finding it. This stuff is adhesive gold. It is unfortunately priced accordingly. It's very expensive. But there's often no better bandaging material when we're doing movable areas like hocks and fetlocks. We do have some products though that help us minimize our use of this, and those are Ecoin sleeve. This is a relatively new product to the market. This is the wide size. This is 2-inch. And this works great at going over the hock. You can see it stretches quite a bit. I've actually taken this size and put it on a horse's head. This is what I like to use for bandaging, the mesh version. They also make a solid version that works really well as a sweat for horses that get cellulitis. It's amazing. But what this allows us to do is we only have to put the bandaging material we need directly on the wound. For example, I would put a telfa on this one, and so I'll only need a telfa and a tiny bit of gauze to hold it there while I put the mesh on. It's completely reusable also. I can wash it. I can do anything I need to it, so if it gets gross, totally reusable, and I'm throwing less stuff away and spending a lot less money. So that is Ecoin sleeve. There are several different versions of that verbiage out there, but Ecoin sleeve is this one, and it's the only one we actually recommend. The other thing that we really like is socks for horses. This wound right here, I would probably do a lot of bandaging with socks for horses. This is a package of 4 of them, and they're literally, as you can see, socks for horses. This contains silver, as we talked about with silver sulfidizine, really good stuff, silver. It's antibacterial, antifungal, antiviral, all the things we want anti, and yet it promotes healing. So silver is fantastic stuff, and it's actually woven into this fabric. It goes on like a sock, provides a bit of compression, and also just protects the wound. So these are really, really good as a bandaging alternative. So you now know what to do. When you come out, you find a wound, you're gonna take a picture, you're gonna cold hose it, you're not gonna put anything crazy on it until you talk to your veterinarian, and then you know what to have on hand to help out your vet and how to bandage it later.